we go to checking with musculoskeletal systems. Muscular means muscles. Skeletal basically the bone and the joints. So this is a big part. We have a lot of ways to examinations. So basically in this part, we checking mainly for the joints, big joints. So we have a lot of joints and we have different kind of joints. So basically in this part, we checking for indirectly connected joints. So when we're talking about physical examination for muscular skeletal systems, basically we mainly checking for the joints to see if the joints have some like a movement limited or maybe some pain around the joints area. So that's mainly we're talking about. So when we checking the joints, the technique, we checking for mainly the big joints. Certainly sometimes we checking for small joints also. So we still follow inspection and may later palpation. So basically, like we talking about, we have 4 examine way, physical examinations. We have 4 ways to examinations. But inspection, palpation may use for all over the bodies. And percussion aspirations mainly we use for the chest and the abdominal area. The other part of the body, like the muscles, joints, we use inspection first. So what we inspection for? Both sides of the joints symmetry means the same. And the shape is normal. So that's our inspections we can compare. Then we can palpation to see if some nodules around there or some muscles weakness in there. Also we can find some skin changing around there. Then we looking the motion of the joints. Like we ask the patients do some movement or motions for the joints. We also have some tests. We will talk about some special tests later. And around the joints, we have ligaments, we have tendons. We're looking if something wrong with it, or maybe some booster or maybe some trauma around the joints, especially people coming for joint pain. And around the small joints, usually we can find the joints inflammation there. Like we talk about arthritis, the joints inflammation, swollen, or even sometimes deformed. So that's basically we checking for the joints. Then we go to individually joints we checking one by one. So let's go to start from head still first. TMG joints. TMG joints. So that's basically connected part, temple bone and the mandible bone in there. So that's why the name coming from. So these joints located on side of the head, right in front of the ear. So that's the joints. When we check these joints, we can put the fingers in there and then ask a patient to open the mouth. Then we can feel the joints moving under your fingers when the mouth opens. So that should be pretty smoothly movement in there. And no pain, no swollen, no tenderness. So that's the normal TMG joints in there. So everybody can try to find your TMG joints. Like if I put my finger in TMG joints with air, truly right now I can feel my joints is moving under my fingers. So that's TMG joints. Clinically, TMG joints is easily caused problems. A lot of people come in with painful situations. Because TMG joints are pretty close or nerve bunch, or cranial nerves. Cranial nerves number 5. Trigeminal nerves, that's the name. Number is number 5. So this nerve bunch coming out from the brain and coming out from our skeletal bone here, right in front of the ear, right close our TMG joints here. So if patient have TMG joints, inflammation or swollen there, truly infected these nerves bunch here. And these nerve bunch mainly functions sensory function or feeling something. Sensory function. So these nerve bunch have some trouble, or TMG joints infected, swollen there, truly can cause the painful in the face. So these nerve bunch, the name we know, tree usually means 3. It means they have 3 bunches. Number 1 bunches go to around the eyes. Number 2 bunches go to around the nose. Number 3 bunches go to around the mouth. The big eye, big eye. So it is belong to sensory mainly. Sensory mainly. We say mainly means they still have some motor part, but sensory mainly. So that means it can cause the painful situation if they have some troubles. If right in the TMG joints area they swollen and cause trouble there, they may cause the whole half side of the face painful. But if it only like infected just 1 bunch, that will cause just that bunch control air, some painful situations. So that's our TMG joints. So that's the first joints we're talking about. Then we're talking about our shoulder joints. Shoulder joints is more able to get movement joints. Basically, we can move it about 360 degrees. So like picture show us, we can move it anyway. Yeah, we can move it anyway. So that's the shoulder joints. So basically, when we're checking the shoulder joints, firstly, we inspection. We're looking both sides of the shoulders look the same. And also, if patient have shoulder joints problems, that's pretty common. Frozen shoulder, like people about around 50 years old or even a little bit older, they complain about the shoulder pain, usually in the one side of the shoulder. So that means if we compare both sides, we can find one side, sick side, mainly is swollen and the redness in there. And the patient will complain about painful. Then we checking for the movement. For the shoulder joints, basically, we have 6 different kinds of movement for the shoulder. When we talk about physiology, we talk about what means flexion, what means extension. So basically, that's a pair kind of movement. More close to the body means flexion. Away from the body is extension. Adduction and abduction basically go to side part. Away from the body is abduction. And then coming back, adduction. And also we can rotation, like 360 degree rotation the shoulder. So we checking to see if any kind of movement is limited. So basically, patient will tell you, oh, my shoulder only can go to like here, then I couldn't lift it anymore because it's so painful. So that's basically we can record it, like abduction about 90 degrees. So with your recorder, put the patient's feel, and the next time when patient coming, even after your treatment, sometimes shoulder pain is a little bit easy to fix. Even after your treatment, you can tell the patient do the same movement, and you can find they even get a little bit more angle there. So that's getting better. So when we're checking for the physical examination for the bodies, basically clinically we can use directly to compare our treatment result. So that's for our shoulder examinations. So we just finished shoulder joints examination. Then we're talking about the elbow. So a lot of people also have elbow joints problems, like tennis elbows. they will feel painful in there. And they will get a limited kind of movement in the elbow joints. So we still inspection first, and looking both sides eyeball should be the same, and looking the skin color, and then we palpate. So palpate, we like the patient's eyeball, little bit flexions. And then specially palpation for the bone in this area. So basically, if patient have elbow joints problems, if we palpate, patient will feel some painful in that area. So that's basically elbow joints. And also, we can ask a patient to do some movement for the elbow joints to look if their movement is smoothly and not limited. So elbow joints basically movement, just flexion and extension, means moving close to the body and extension away from the body. So elbow joints a little bit simple compared with the shoulder joints because elbow joints don't have too big movement in there. So that's the elbow joints. Then we're talking about the wrist and the hand, the wrist joints and hand. So wrist joints and hand, that's most people possible have some trouble, like arthritis. Swollen joints, when we inspections, we can see swollen joints and deformed joints. So that's pretty commonly for people with arthritis. And certainly we can palpation for the joints. Put our hand like a part behind the patient's wrist joints here, and with the thumb palpation. So over the joints area, and then ask patient if some special area they will have tenderness or painful. Also, we can see if swollen there. So that's for the wrist joints. And also we go to small fingers. 8 couple bone. Basically it's small joints here. So between the metacarpal bone and the carpal bone here. So basically, we still looking both sides. It's the same size, same size, same color, same shape. That should be normal. And then we looking if something wrong in there. Looking something wrong in there. So that's palpation. Palpation. Certainly, we still looking the movement of the wrist joints and the fingers. So we still have flexion kind of movement and extension kind of movement. Tell the patient do flexion and extension for each of the fingers. For each of the fingers. We can start from thumb. That's the picture. This is the thumb. But truly, we can do each of the fingers to see if patient has some movement limited or maybe some painful in there. So that's the elbow and the hand joints. Elbow and the hand joints. Now we're moving to spine. To spine. when we're talking about the span, basically we say normally we have 4 curves, 4 natural curves in the span. So that's normal situations. These 4 curves keep the body normal, like a movement and normal functions. If the curves disappear, that's abnormal. So when we inspections, firstly we looking these 4 curves. That should be in there. If any kind of curves is disappeared, that's abnormal. So that's firstly we talking about inspections. So you see even like people with tissue there, with muscle there, but we still can see the curves. Yeah, we still can see the curves in different parts of the body. Yeah. And we have another one. So that's normally we looking firstly looking from the side and looking people if they have normal curves there. Then we checking for the movement. Yeah, we checking for the movement for the spinal. So spinal area we including different parts. So we have neck part. Yeah, neck part. Neck part we can moving to left side and the right side. Normally at least 45 degrees. That's normal. If some people less than 45 degrees, that's abnormal. Yeah, that's abnormal. And we also can moving to the front and the back. That's about 35 to 45 degrees. So that's the normal range people movement for the height. And also we say we can turn the neck. Yeah, we can turn the neck. So these 2 pictures is different here. The first leg, just moving to one side to other side. The second picture means you turn your neck to left side and right side. That's 60 to 80 degrees. So that's the turning, turning the head. So that's the head area. Yeah, that's the head area. We have 3 different kind of movement. To the side, front, back, and then turning. Then when people standing, for the chest and the back area, we can bending forward about 90 degrees. That's like a flexion. Yeah, like a flexion kind of movement, 90 degrees. And basically it's kind of extension. Yeah, extension. We say extension to here and over extension. That's about 30 degrees or X extension. That's normally people can do. But truly, like we see some TV show, especially for kids, when they training for a long term, they even overextension about 180 degrees. So that's for some people especially. But for normal people, yeah, we just talk about the normal people here. So that's front and back kind of movement in there. And when people standing straight, they still can move into side. Kind of abduction, or side or lightly flexion. So that's about 20 to 35 degrees. And the people still continuing, Left side and right side, pretty similar like a head part turning, about 30 degrees for both sides. Here, 30 degrees. So that's the spinal movement. In different part, the movement is different. And we also can palpation for the spinal. So palpation, we can sitting there or standing there. So ask patient to sitting there or just standing there. And the palpation for each of the spinal process with the thumb. And then ask patient if they feel some painful in there. And also we feel the space between each of the spinal process. We say in the spinal area, we can separate a few parts. For the neck part, the space a little bit smaller because they curved like this. So make the space pretty smaller here. And the chest part and the upper lumbar area, we say chest part space little bit smaller compared with lumbar area, because lumbar area, the vertebrae is bigger, and the vertebrae in the thoracic area or chest area is smaller, so that's the space little bit different. But generally say, like if we go to upper back area, the space pretty similar. And we go to lumbar area, the space is pretty similar there. If some space pretty smaller and difficult to fill the space there, it's possible some vertebrae trouble in there. So that's basically when we checking the spinal, we inspection first, and then we checking the movement, still by the inspection, and then we palpation. So that's for the spinal area. Now we're moving, for some the hip area, and some special tests in the hips area. So lower back pain is pretty common problems for some people. A lot of patients coming with lower back pain, and some lower back pain radiate down to legs. That's basically caused by sciatic nerve troubles. So sciatic nerves is the largest nerves in the body. We say they coming out from L4, L5, and S1, S2, and S3. So then they meet together. And form a big nerve bunch. That's we call sciatic nerves. So travel in the hip area. So they are located in the middle way between the great trochanter and the ischial tuberoses area. So basically, we find the big trochanter. We can find the visual palm place there and find the big trochanter. Then we find a bone behind it. Then put your hand in that area. If patient have like a sciatic nervous disorder, then you pressure there, they will feel painful. So thus we checking for people who have sciatic nervous problems, especially. So thus basically we put spinal and limbs area together here. We talking about spinal cord first already, inspections, and the movement for the spinal we finish already. And then we say palpation for the tenderness. So percussion for the pain, is not that commonly used, but still, if we find some pain in some special area, we still can use the percussion way, try to find painful, like some tapping in some special area. Then in this area, we have some special tests. I think from the video, we see some tests already. Now we're talking about these special kind of tests one by one here. So that's still checking for the spinal area mainly. The first one we go to Jackson's test. So lot of like Western medicine use this name, or maybe the test they name by the doctor's name. Like that doctor originally found that kind of test. So people sitting there, patients sitting there, and then the doctors put a pressure on the head area, slightly pressure on the head area, and then rotation the patient's head to one side, and then pressure down, and then coming back to other side, then pressure down. So this kind of test, if patient feel painful, and especially that kind of pain, radiation to the arms, that means positive. Positive means patient have a cerebral nervous root kind of disorder. So that's basically for this test. Usually, if the bone in there have a kind of deformed, or maybe swollen, or maybe inflammation, then got some pressure for the nervous sponge in there. Then when we do the Jackson test, patient will feel pain, and they will radiation to, usually it's one side of the arm, but still possible go to both sides. Certainly, which side got painful, mainly problems in which side. So that's basically we checking for the neck area for the bone problems and then cause the patient painful in there. So that's we call Jackson test. Jackson test. So that's for Jackson test. Then we go to the second one. So basically we have 4 tests here. Yeah, 4 tests here. The second one we call it flexion rotation test. Flexion rotation test. So patient lay down there. Yeah, patient lay down there. Then we still turn the patient's head. Yeah, lifting the patient's head a little bit, and then rotation the patient. Then rotation the patient. So basically, these tests we checking C1, C2 disorder. We say rotation the head. Yeah, rotation the head, like we have picture before. Rotation the head will have like a 35 to 45 degree more normally. Yeah, normally. Both sides. So we lifting the patient's head, then rotation it. In the video, they just use like a tools, just looking for the degree, how much degree easily in there. But even we don't have that tools, we still have kind of measurement. That's 90 degree, that's 45 degree. So basically, we still can measurement about 35 to 45 degrees there. Yeah, we still, if we don't have that special kind of tools in there. So we say, if patient like a rotation the height less than 35 degree, even less than 32 degree, that means the test is positive. The test positive means patient have troubles in C1 and C2. So that's still the bones trouble in there. So that's the second test. We say flexion rotation test. Flexion means moving the head more close to the body. Rotation, just rotation to both sides. And then we see the degree or angle there. So this one still test for the vertebrae in the neck area. Then we go to the third one. Yeah, then we go to third one. So still the doctor's name here. Still doctor's name here. So basically when we test, we're still looking for some painful situation. Patient still can sitting there. So basically this test, we passing patient's jugular vein on the neck area for 30 seconds. Yeah, for 30 seconds. And then ask patient's cough. Then if patient feel painful situation, then still positive reaction in there. So basically, still the same idea. Because we blocking the jugular vein in there, and then ask a patient cough. That will cause the more pressure. Yeah, more pressure go to the spinal area. That pressure will go to the nerve root area. If patient have the problems in that area, then patient will be cause painful situation. So pretty similar like last two, just more pressure go to there. Then we go to the last one. So this one pretty similar like we looking in the video before. So last test, we need the patient lay down there. Patient lay down, the knee extending, like a straight line in there. And then flexion the hip joints, like lifting the leg, from here to here. Thus, it means flexion for the knee joints here. Small angle here. So then patient may feel pain in the lower back and the hip area. So that means positive for this type. So basically for this test, we say still checking for the lumbar area for sciatic nervous painful situation. So we have two ways to do it. One way we do the same leg. If the degree less than 30 degrees here, then patient feel pain. So normally, people can lift the leg about 45 to 60 degrees without pain. But if less than 30 degrees, then patient feel pain. So like the video, the patient left their head, so mainly that's because painful. And also patient can tell you they feel pain in there. So that means positive. And certainly we can go to the other legs. We can go to other legs to lifting. And the patient feel pain in the sick leg. So that means positive. That means positive.